Hello and welcome to my online human anatomy lecture. Well, you've made it this far, so congratulations. This is now going to be a comprehensive review. Of course, not the only exclusive review. You should be reviewing all the material in the course, but at least this gives you a good idea on some of the main points to focus on. Okay, so again, this is not the only thing you should be studying. This is just a nice summary of what we've been talking about this entire semester. Okay, so let's go ahead and get started. Oops, gotta review that first. Okay, so at the beginning of our journey here, we were talking about the biological hierarchy, and we definitely talked about tissues. And tissues here is a group of cells which are usually similar and share a particular function. When you have a whole bunch of tissues that come together and they work and cooperate together for a particular function, then we have an organ. Okay, and then that organ will begin to function on its own. And if we have multiple organs that are working together, then we have an organ system, and so on and so forth. Okay, one of the first organ systems that we studied in our anatomy class would be the integumentary system. And then so to refresh your memory on some of those structures, we've got the erector pili in the skin, which are tiny muscles that make the hair stand up when you have goosebumps. We have the hair papillae, which is what's destroyed by hydrolysis so that your hair won't grow back. Electrolysis, not hydrolysis. By the way, it is 4 o'clock in the morning over here, so I've just been on a roll doing these lectures. The hair matrix is the leading edge of the papillae and is actually skin cells or keratocytes, which are rapidly dividing. When they die, the new ones push them out, forming the hair. The hair is just dead skin cells, and the hair root is just the base of the hair. Now, the hair matrix is the part of the follicle that is the site of the hair growth and the location of the melanocytes that determines hair color. Hair that goes gray has lost its melanin pigment, and that's why people always have to dye their hair to put back the ink or the dye, give it some color. Okay, the layers of the epidermis here, starting with the most superficial layer, superficial, and to the deepest, down here. Okay, we got the stratum corneum, stratum lucidum, which is only in the thick skin, stratum granulosum, which is when cells start to die here, stratum spinosum, and the stratum bacilli. You might want to go back and review the notes, or if I have an online lecture for this, the integumentary system and the little story that I have there to remember each of these layers. Okay, some of the types of skin cancer here. The most common cancer in the United States here is skin cancer, and its major risk factor is ultraviolet light. Some examples include basal cell carcinoma, where it is a cancer of the blood vessels here. It almost never metastasizes. So again, to refresh your memory, metastasize means it can move from one place to another place in the body or crosses the basement membrane. And these guys look like shiny nodules. The second one here is squamous cell carcinoma, which accounts for 25% of all cancers, and it will metastasize if it's not treated. And then you have melanoma here, which is a cancer of the melanocytes of the epidermis. These are highly metastatic. These are asymmetrical, in shape, but irregular borders and edges, and these are not uniform in color. So once again, the way to check for those are your A, B, C's. For asymmetry, check this border and color. Okay. Now, different burns here. You got first degree burn, which is a minor burn to the epidermis, which is sunburn. There's second degree burn, where the dermis separates from the epidermis, which forms a blister. And then you have third degree burns, which is where the hypodermis is burned, and is the most severe type of burn. You have keloid scars, which are thick, red, and painful scars, and a hemangioma, which is an enlargement of the lining of blood vessels and is treated with lasers. We definitely talked about piebaldism earlier in our journey here. This is a rare autosomal dominant disorder of melanocyte development causing a congenital white patch of hair. I call this the rogue effect, but that has nothing to do with anatomy. I always am reminded of the X-Men character Rogue when I see this. Okay, next up, let's talk about the bones. There are two types of bone tissue here. We've got compact bone, which is dense outer layer of bone, and these are found typically in the diaphysis of long bones. And then we have spongy cancellous bone, which is an internal network of bone found in the epiphyses of bones. So remember that the diaphysis here, so if I have a bone, okay, this would be the diaphysis, okay? The epiphyses would be this, okay, or this. That would be the epiphyses, the outer parts of the bone. Now, some conditions here, osteomalacia, we've definitely talked about. This is rickets caused by the lack of vitamin D. Achondroplasia, where there are complications with the cartilage that can lead to dwarfism. And chondromalacia here, this is where you have the cartilage that ends up rubbing off, usually under the kneecap or the patella of active individuals. Now, the bones can crack. And when they crack, we don't call them a bone crack, we call it a bone fracture. And there's several different ways we can classify that. One, we can call it a simple fracture or a closed fracture. This type of fracture is when the skin hasn't broken through, and it may require a cast to make sure that the bones stay solid in one place so that the bones can heal. There's another type called an open or compound open fracture, and this is when the bone has broken through the skin, and it increases the chance of infection, which can be life-threatening, and requires surgery, hospitalization, and IV antibiotics. So again, when you have an open fracture, it has pierced through the skin. When it pierces through the skin, it's exposed out here to all the pathogens that are flying around all over the place. And so it is more prone to infection. There is something called an incomplete fracture where only one side of the bone is broken. A complete fracture here is where you have both sides of the bone that are broken. And these can be classified as two types. One is a complete displaced fracture where the bone fragments unfortunately don't puzzle in together. So a lot of times when a bone has broken or has fractured really badly, the physician's going to try to puzzle those pieces back together the best it can, because if they don't align the correct way, you add extra stress on different fragments, and that can cause bone spurs, okay? Now, a non-displaced one is where you get lucky and all the bone fragments do line up, and so they'll eventually reconnect back together and it should be okay. Other types of fractures include the comminuted, and this is the most serious type of closed fractures where the bone shatters in a lot of pieces and it makes it very difficult to puzzle back together. A bone graft might be needed. A spiral type here is when the bone is twisted. It can lead to a spiral fracture. A green stick fracture is one that's most commonly found in children. A compression fracture is where the bone gets crushed. It's like a vertebrae in osteoporosis. You get stress fractures, which are the least serious types. These are very tiny, almost invisible breaks, and they tend to heal much faster. And of course, we've talked about open and simple and closed fractures here. And pathological fractures, when the bone, especially the hip bone of someone with osteoporosis, breaks first, then the patient falls. Now, there are two, now let's move on to joints, okay, which is arthrology, right? Now, there are two ways that we can classify joints. We can classify them based upon the type of movement it allows. So there is no movement, limited movement, and free movement. Okay, what is the name of the joint when it doesn't have any movement? You should better say synarthrotic. How about limited? You better say amphiarthrotic. And free movement is diarthrotic. Okay, now what tissues joins the bones? Well, you have several different types. You've got the fibrous joints, which are made up of fibrous connective tissue, made up of dense regular connective tissue. And examples of these include the suture, the tooth, and the ligaments. You have cartilaginous joints here. You have fibrocartilage. Examples include the vertebral disc and the pubic symphysis. You've got the hyaline cartilage here, which contains no capsule. Examples are in the epiphyseal plate and the costal cartilages in your ribs. And then you have synovial joints, which are made up of hyaline cartilage containing a capsule. Once again, those types of movements here, as I've described, you better know these: synarthrotic, amphiarthrotic, and diarthrotic, as I've discussed moments ago. Okay, next up, we've got the cartilaginous joints here. The cartilaginous joint is two bones joined by a cartilage, and the cartilage is either fibro or hyaline cartilage. If it's fibrocartilage joints or symphyses, these are amphiarthrotic or slightly movable, and examples include your intervertebral discs and your pubic symphysis. Hyaline cartilage joints or synchondroses are synarthrotic or immovable. Examples are the epiphyseal plates and the costal cartilages. Therefore, one type of cartilaginous joint is slightly movable, a fibrocartilage, and one type of cartilage is immovable, which is like hyaline cartilage. Okay. Now, ligaments here, the joint capsule alone is not strong enough, so you have reinforcing ligaments which provide the most strength for holding bone to bone. Okay, bone to bone. And they are made up of dense, regular connective tissue. Now, in the knee joint, the collateral ligaments are the main ligaments that keep the knee from moving side to side. Okay, so you don't want the knee to over to the side. You want them to go in the front. Okay, and so therefore you have those collateral ligaments to hold them in place. Okay, as we recall from our previous lecture, ligaments take a very long time to heal because they are not near a blood supply or blood vessel like bones are. Bones are innervated and networked with all these capillaries and blood vessels, but not ligaments and not cartilage. They already have enough fibroblasts and cartilage though, so they will eventually heal, but it just takes longer to do so. It is better to break a bone than to tear a ligament for obvious reasons because bones are better networked with blood supply and nutrition. There is a difference between sprain and strain. Sprain has a P, strain has a T, but if you get a sprain, that's a tear in the ligament and is fairly serious. When the ligament is sprained, it can take up to 6 months to heal. So ligaments do need nutrients. Okay, don't get me wrong, they do need nutrients, but the blood vessels are far away, so they're waiting for the nutrients to diffuse across, which takes a long time. Now, even with a partial tear, you have to be very careful. A strain here is a tear in the muscle and is not as bad because it has good circulation and heals faster. If you can walk on it and it heals in a couple of days, you had a strain with a T. Okay. All right, moving on down to skeletal muscle here. For the skeletal muscle, it contracts, and for it to contract, the neuron must first release out a chemical called acetylcholine, which is a neurotransmitter. Okay, and there are many neurotransmitters out there. Acetylcholine is just one example of a neurotransmitter. And they release it into a region called the end plate. And once it does so, then calcium will get flooded out, okay? And calcium is needed for muscle contraction. On top of strengthening your bones, calcium is primarily needed for muscle contraction. If you don't have enough calcium in your muscle tissue, eventually your body's going to take it away from your bones and feed them into your muscles so you can contract those muscles. The nerve signal that passes through is called an action potential. That is the neural impulse, okay? And it causes a release of calcium from the muscle fiber, which causes a contraction. Now, you don't want to get these confused. A muscle fascicle is a group of muscle fibers surrounded by a paramecium. A muscle fiber is a single muscle cell. A myofibril is a long organelle inside a muscle fiber, and that contains actin and myosin myofilament proteins. Okay, and the myofilament are the proteins itself, and there are two types, and again, actin and myosin. Actin contains troponin and tropomyosin proteins, okay? And the myofilament is the lowest level of organization that is composed of actin, myosin, troponin, and tropomyosin proteins. Okay, therefore, a myofilament is part of a myofibril, which is inside a muscle fiber, which is inside a muscle fascicle. So again, we move up. Now, how muscles contract, there is the sliding filament theory, and the contraction results as the myosin heads of a thick filament attached like hooks to the thin actin filaments at the ends, both ends of the sarcomere. And the sarcomere is that fundamental unit of a muscle, and pulls the thin filaments toward the center of the sarcomere. The myosin head is like a hook with a hinge. After a myosin head pivots at its hinge, it draws actin closer, then lets go. It springs up again to grab the actin filament again, pulls it closer, and it keeps repeating this until the entire actin filament has been drawn in as far as it can go. The sites where the myosin heads hook onto the actin are called cross bridges. Okay. And of course, the proteins involved, we have in actin. Okay, we've got troponin, which is a complex of 3 proteins, and tropomyosin, which is a single protein. Again, more details about this in the muscle lecture. Okay, both troponin and tropomyosin cover the actin filament when the muscle is relaxed. The phrenic nerve controls the contraction rate of the diaphragm. Okay, so definitely there's a lot of talk about creatine out there. What do we do when we run out of ATP? Well, the muscle fibers here can't stockpile ATP in preparation for future periods of activity. So it's not like your body knows you're going to go for a run tomorrow, so better stock up on ATP in the form of creatine. However, it does store another high energy molecule called creatine phosphate, which is a storage form of ATP. And this is only made when you have extra ATP around that we accumulate while resting. But it doesn't stockpile on ATP because you're going to run tomorrow. Okay, it just does so naturally on its own. During short periods of intense exercise, the small reserves of ATP existing in a cell are used first, and then the creatine phosphate is broken down to produce ATP. Muscular dystrophy here is a genetic lack of the protein dystrophin, and therefore muscles aren't able to contract. There's 3 different types of bone cells here that help to maintain your skeleton. We've got the osteoblast, which makes bone, osteoclast, which reabsorbs or cuts bone, and then we have the osteocyte, which helps to maintain. Okay, and when a person gets a bone infection, it's called osteomyelitis. Now, the osteon is the functional unit of a compact bone, okay? And again, we've talked with osteocytes. Now, the osteocytes here are housed inside little mini caves in the bone called lacunae, and that's where they live, okay? And then you have little canals inside of these bones called canaliculi for the legs of each star-shaped osteocyte. And the canaliculi allow for the diffusion of nutrients and waste to other osteocytes because the bony matrix is so thick and dense with calcium and mineral deposits and everything. It's very difficult for nutrients to just diffuse its way through the bone. So you need these canals to allow blood vessels to travel through so it can nourish all the different bone cells and osteocytes, osteoblasts, and osteoclasts that are in there. Now, lamellae here, these are the circular and concentric layers formed by the osteocyte matrix because they sit next to each other in circles. Now, osteoarthritis here is common in older people, and the articular cartilage begins to break down and bone spurs begin to grow. Rheumatoid arthritis, it's an autoimmune disease where the body attacks and destroys a cartilage in the synovial joints. It is not known for having spurs, but like osteoarthritis does. Now, gouty arthritis or gout, this is caused by eating too much red meat or protein, and the breakdown product here is urea and acid, which causes uric acid crystals in cooler areas of the body, especially in the big toes. Now, you have glial cells in your nervous system, and there's several different types of glial cells. The first are the oligodendrocytes, and these are found in the central nervous system. That's key here, found in the central nervous system. And these are very large and complex cells. And the oligodendrocytes form the famous myelin sheath, which helps to speed up the conduction of a neural impulse. And this sheath is a covering around the axon to speed up the neural conduction. Now, outside of the central nervous system, that myelin sheath, there's another name for it. It's called a Schwann cell. Okay, and each Schwann cell only forms one myelin sheath. Okay, you can see here. And they form in the clam shape. Okay, clam shape formation. Clam shape formation. Okay, these guys here, the myelin sheath in the central nervous system, it's like candy cane like formation, spiral formation. Okay. Now the action potential jumps from one node of Ranvier, which is a bare area. So here we have it. This is the node of Ranvier right here. Okay. It jumped from one bare area to the next node, skipping the myelin that is between the bare areas, and that speeds up the overall nerve conduction. Therefore, a myelinated axon conducts impulses faster than an unmyelinated axon. So why aren't all the neurons myelinated? Again, the reason why they're not all myelinated is because it requires high maintenance to keep those cells alive. And so your body doesn't have that much resource to keep all the nerves maintained with a myelin sheath, okay, or a Schwann cell. And so instead it dedicates and it picks certain systems to innervate with myelin sheath and Schwann cells, and other ones like your digestive system where a quicker impulse isn't really important, they won't put it there, okay? Well, again, it uses up a lot of nutrients, high maintenance, and it's better to invest a myelin sheath or a Schwann cell on places where we do need it, like your skeletal muscles. So when there's a bear running after you, you can quickly respond. An example of a neural disease here is multiple sclerosis, and that is an autoimmune disease where the oligodendrocytes, or the myelin sheath, are being destroyed, and that process is called demyelination, and that interferes with neural function in the central nervous system. And the oligodendrocytes, unfortunately, can't regenerate this myelin sheath. Now, multiple sclerosis is the most common neurological disease of young adults, and it starts to manifest itself in as early as in the early 20s, and it progresses to paralysis and sometimes death. 1 out of every 1,000 people get it, and there are treatments, but unfortunately no cure. Now, speaking of the nerves, we have several cranial nerves. Well, we have 12 cranial nerves. We'll talk about a couple of them here in our review. Okay, the 5th cranial nerve is called the trigeminal nerve. This is the main sensory nerve of the face, and it has a large branch that passes through the foramen ovale of the skull, and it's got 3 parts. When a dentist numbs the lower teeth, he injects a mandibular branch, and for the upper teeth, he injects a maxillary branch. The superior branch is the ophthalmic branch, and problems with the 5th cranial nerve are called the trigeminal neuralgia, which is excruciating pain in the face due to nerve inflammation. Again, neuralgia means pain. Neuro means nerve. Okay. The 7th cranial nerve here is the facial nerve, and this is the main motor nerve of the face, and it innervates the muscles of facial expression. A person who cannot blink or smile may have damage to this nerve. Someone with a damaged facial nerve cannot easily taste sweet, sour, or salty substances. It also supplies a parasympathetic innervation to most salivary glands. Bell's palsy, here's one example of a damage to the facial nerve, causing paralysis on one side. The nerves end up swelling from an infection by, say, the herpes simplex virus, but only the motor nerves are involved, not the sensory, so it's painless. That needs to be distinguished from a stroke, okay? The 9th cranial nerve here is a glossopharyngeal nerve, and it cooperates with the 10th cranial nerve to carry information from the baroreceptors in the head and the neck to the brainstem, and the baroreceptors help to measure like blood pressure. The 10th cranial nerve here is the vagus nerve, and it's the only one that wanders into the thorax and the abdomen to supply neural impulses to all these important organs. Now, in the brain, okay, in the brain, you have the precentral gyrus. And this is there is a precise map of the different body parts in the precentral gyrus. And this map is called the motor homunculus, or little man. And not all the body parts are equally represented by cell density in the motor area in proportion to their size in the body. The lips, part of the face, and hands enjoy especially large areas of the cells in the motor area. The face region of the homunculus is large, so we can have many facial expressions. The hands and the tongue are large, indicating that we have many fine motor skills in those areas as well. Now we have sensory tracts. The sensory signals go to the brain via the tract, and a tract is a collection of axons inside the central nervous system. Okay, now a visceral nerve innervates involuntary effectors, like your smooth muscles in the organs. A somatic nerve innervates voluntary effectors, like your skeletal muscle, okay? Some brain diseases we've talked about in the past, hydrocephaly, which is a congenital type of disease caused by a blockage of the cerebral aqueduct in the brain. And so the cerebral spinal fluid is made but can't leave, so it bloats out the brain, okay? Meningitis here, this is when the meninges become infected and can be caused from a virus, and that's not that bad, or bacteria, which can be fatal. The main symptom is a headache. Now, encephalitis here, this is infection of the brain, and it can be caused by mosquito-borne illness or bacteria, and treatment is to remove a piece of the skull bone to allow the swelling. Now, the auditory association area here, this contains two special regions. The first of which is called the Broca's area, and that allows for speech. If you have a complication in the Broca's area, the person can't speak. They know what they want to say, but they just can't say it. So they have difficulty speaking or can't speak at all. If they can't speak, it's called aphasia, which is a type of dysphagia. Dysphasia, which is difficulty speaking. Now, the second area in the auditory association area here is the Wernicke's area, and that allows for the understanding of words. The person can speak just fine. They can say what they want to say, but when someone speaks to them, they can't comprehend that. And here is the location of where the Broca's and the Wernicke's area is. Okay, we zoom in, we can see that's where it is. This is the anterior, this is the posterior portion of the brain. Okay, this is what happens when you have phrenic nerve damage. You can have the hand of benediction, carpal tunnel syndrome, claw hand, and even wrist dropped. And these are the different injuries that happen here: median nerve injury, ulnar nerve injury, and the radial nerve injury for each of their respective ones. Okay, now sciatica here is an inflamed sciatic nerve. Neuroma here is an inflamed nerve in the ball of the foot, often caused from wearing high heels. Now, some eye disorders here. Presbyopia here occurs around age 40 to 50, where the lens can no longer accommodate. Typically happens in elder individuals, why they call them old eyes. Hyperopia here is farsightedness, where the eyes are too short. They can see far. Okay. Myopia here is nearsighted, where they can see near. Cataracts here is a clouding of the lens. Retinal detachment we've talked about, where the retina becomes detached maybe due to a blow in the head, maybe a baseball bat has hit there. It's very deadly, and within 24, 48, sometimes 72 hours, that can lead to permanent blindness. So you have to go to an ER. This is an emergency situation. Astigmatism here is when the cornea has an irregular shape. Macular degeneration is the most common cause of blindness in the United States and is due to the bleeding in the eye causing scar tissue. Diabetic retinopathy here is the high sugar levels that destroys the photoreceptors in the retina. Glaucoma here is increased pressure within the anterior chamber of the eye that can lead to blindness. And amblyopia here is lazy eye. Vertigo here is inflammation of the semicircular canals in your ear. And that gives you a sense of motion when you're not moving, leading to dizziness. Okay, talking about blood. Recall that a hematocrit here is a quick screening test for anemia. A drop of blood is drawn into a glass capillary tube. It's centrifuged and spun, and then the heavier red blood cells pack toward the bottom. The lighter liquid plasma packs toward the top, and then the white blood cells kind of hang out in the middle. The hematocrit is the ratio of the packed red blood cell to the total volume of blood, and in men, it's normal at 46%, women 38%, and normal on the average is 45%. Now, some blood diseases here, we have anemia, which is when the blood's capacity for carrying oxygen is diminished. Has nothing to do, it can have something to do, but it is not connected with the number of red blood cells. For sure, if you have not as many red blood cells, it will diminish the body's capability of carrying oxygen, which is an example of anemia, but it's not strictly anemia. Okay, so you can have a lot of red blood cells, but if the hemoglobin is not working, you are still anemic. Okay, and I definitely emphasize that in my online blood lecture, or my blood lecture. Now, this can be caused by blood loss, deficiency of iron, deficiency of vitamin B12, folic acid, maybe a lot of red blood cells are being destroyed, or genetic defect of hemoglobin. All of these can lead to anemia, not necessarily low red blood cell count. Okay. Now, leukemia here is cancer of the stem cells, results in too few normal white blood cells, although the overall white blood cell count may be high. Once again, when the body senses that the white blood cells aren't doing an effective job, it panics and freaks out and sends out immature white blood cells, and that leads to a high white blood cell count. Doesn't necessarily mean that each one of those white blood cells are doing a good job. Okay. Thalassemia is a form of anemia. The red blood cells have abnormal hemoglobin here, so that causes the person to get sleepier more. Sickle cell disease is present typically in African descent individuals more than any other ethnic group, and is always characterized by sickle cell red blood cells. Thrombocytopenia here is when you have too few platelets and the blood doesn't clot all the way, doesn't clot properly, I'm sorry. And a thrombus is a blood clot in a vessel. An embolus is a thrombus that travels in the blood. So we definitely talked about this. It's a thrombus if it's stuck. If it tumbles down the bloodstream, then it's called an embolus, okay? Now, immunotherapy here is a form of cancer treatment that takes blood cells from a patient and fuses the blood with an antibody that is specifically designed to seek out and destroy cancer cells. All right, let's talk about the heart. Okay, the left ventricle, as you can see here, has the most muscle because it is the final chamber that blood goes into before it goes to the rest of the body. So we need a lot of pressure and force so it has enough energy and motivation to go through the entire system. It pushes the blood out of the aorta to be distributed to the rest of the body. Therefore, it is a chamber which has the greatest pressure upon contraction. And here are the different chambers here: right atrium, left atrium, right ventricle, left ventricle, tricuspid valve, bicuspid valve, pulmonary pulmonary semilunar valve, aortic semilunar valve is somewhere back here. Aorta, right here. So we have the aortic semilunar valve. Okay. Superior vena cava, inferior vena cava, pulmonary and artery and vein. Okay. All right. So when the heart beats, it does not need a nerve to stimulate it to contract. They can contract on their own. However, they will contract like a madhouse. So you need the SA node, which is the sinoatrial node, in order for them to be in sync. Okay. Specialized heart cells can spontaneously start an action potential that spreads to depolarize the rest of the cardiac muscle cells. But first, the sinoatrial node starts an action potential which causes the atria to depolarize. This depolarization will eventually reach the AV node at the bottom of the portion of the right atrium. And there is a delay here because the cells are so small in diameter, and you need that delay so that there's time for the blood in the atria to empty into the ventricles, right? Or to fill the ventricles. Another delay in the transmission of depolarization is at the bundle of His, or the atrioventricular bundle, because these specialized cells travel through the atrioventricular septum, which is non-conductive, so they don't contract. Next, the depolarizing event travels through the left and right bundle branches found in the interventricular septum to finally arrive at the Purkinje fibers in the ventricular myocardium. And that's when the ventricles will eventually contract. Now, when the ventricles contract, it's called systole. When the atria contract, it's called diastole. So I use V to S as A to D. Okay, ventricles, systole. Atria, diastole. And when you're measuring blood pressure, okay, think about the left ventricle being the strongest force in pump. So here it is, 120 is pretty strong. That must be the ventricular contraction. The second number here is always the atrial contraction. Okay. Now, some heart disorders here include pericarditis, which is an inflamed outer layer of the heart. Endocarditis is due to bacteria that enters the bloodstream. A heart murmur is when a valve kind of doesn't close all the way and blood goes in the opposite direction, causes a sound. And a prolapse valve is when a valve completely goes in the wrong way. It just flaps out in the wrong direction. This is more serious. The mitral valve, as we've mentioned in my previous lectures, is more likely to prolapse because it pumps the hardest. Okay, if you look here, the bicuspid valve is right before the left ventricle, which contains the most muscle. So it's more likely to be blasted in the opposite direction. Okay. And if that happens, they might need an artificial valve transplant or replacement. Okay. Arrhythmia here is a problem with the SC or the AV node that can lead to an improper heartbeat. And the treatment here, either use medication to reset it or use a pacemaker to override it. Angina here is when you don't have enough blood that goes to the heart wall, leading to severe pain and chest pain. And myocardial infarction is due to a complete blockage, not enough oxygen going to the area, which is ischemia, that's a term, and that part of the heart muscle ends up dying off. Now, an angioplasty is a surgical procedure to clean out clogged arteries, and aspirin is typically prescribed to reduce blood clot formation, especially after the heart has been operated on. Because after that, there's a lot of trauma that happened in the heart, and so thrombocytes tend to like to coagulate there. So aspirin helps to reduce that. And nitroglycerin will help dilate the coronary arteries, definitely helpful in emergency situations. EMT paramedics will give patients with a heart attack nitroglycerin to help dilate their coronary arteries to buy them some time until they get to the hospital. Atherosclerosis here is caused from eating fatty food, and that's the buildup of fat inside the artery or the narrowing of the artery. Ventricular fibrillation is when the ventricles are going bananas and they're unable to pump blood efficiently due to rapid random contraction of the cardiac muscle fibers in the ventricles. The muscle doesn't contract as a unit, and the treatment here is to defib or defibrillate, okay, with an electrical shock to override the cells. And I definitely had a really awesome analogy with orchestras, conductors, and section leaders and everything in my heart lecture. So check it out. Congestive heart failure here is progressive weakening of the heart as it fails to keep up with the demands of pumping blood. The coronary bypass here, you take another blood vessel graft from the thigh and you go through the blockage, right? Around the blockage. So the coronary bypass, they will take a vessel, say from the greater saphenous vein, build a vessel, put it in the heart, and tell the blood to go that way instead of through the avenue with a blockage in it. Sometimes that can lead to baby blue, where you have low oxygen levels in the blood that may be due to failure of the foramen ovale to close at birth. Okay, so baby blue is not due to a coronary bypass, as I had accidentally misspoke there. It's due to the foramen ovale not closing. So therefore, they don't get the oxygen from their lungs, okay, because the foramen ovale is supposed to shut between the left and the right atria. But in the developing baby, that is there to bypass the lungs, so the lungs aren't breathing at that time, right? When the baby is born, it's supposed to close. But if it doesn't close all the way and blood still goes through the avenue, it can lead to baby blue because they don't have effective oxygen transport. Okay, the saphenous vein here is often used to bypass a damaged coronary artery in the coronary bypass surgery. It is the most likely vein to become varicose or twisted anyway, so that's why they'll use it. The facial vein here, when you squeeze pimples and the nose piercing, it gets into the danger triangle of the face where any sort of microbe that makes its way through there can end up in your dural sinuses of the brain, can cause some pretty bad infections. Disorders of the lymph system here, we've got Hodgkin's disease, which is the cancer of the lymph nodes, mainly enlarged lymph nodes that do not feel tender here. Mononucleosis, or the kissing disease here, Epstein-Barr virus attacks the B lymphocytes and causes inflammation of the lymphatic vessels. Edema is the accumulation of excess tissue fluid in loose connective tissue. You've got lymphangitis here, where the lymph vessel inflammation, usually due to an infection. And bubo is an infected lymph node that contains a large number of pathogens that are trapped in the node but not destroyed. I'm about to get laryngitis right now because I've lectured 3 lectures straight today. Laryngitis, I mean, is where my voice is gonna get inflamed. I'll have inflamed vocal cords, and that will decrease my sound production. That can lead to scar tissue nodules, where singers like myself, we get this, and it may require surgery. So if the vocal cords aren't being taken care of, that can lead to scar tissue nodules. Some respiratory disorders here, influenza. This is the common flu due to the influenza virus. And this is what you get vaccinated against when you get the flu vaccine. But obviously the vaccine only works for the flus that are covered under that vaccine. But if the flu mutates into something completely different that no one has studied or created a vaccine for, you have to get revaccinated, updated vaccine. Lung cancer here is the #1 or #2 most deadly form of cancer. 85% of lung cancer is caused from smoking. Respiratory distress syndrome here, where premature babies don't get enough surfactant, and that can lead to the alveoli closing shut permanently. Pneumothorax here, or the collapsed lung, due to a hole in the pleura, injury from a broken rib or a knife, and it's like opening the stopper, the air flows through the hole and the lungs don't inflate. So one of the ways that they take care of this in an emergency situation is to close up that hole the best you can so the air doesn't run out or run into the hole to collapse the lungs. Pleurisy here is an infection of the pleura, the rubbing together of inflamed pleural membranes that produce a stabbing pain in the chest with every breath, and it feels like a broken rib. Inspiration is breathing in. Inspiration, inhalation. Okay? The diaphragm and the external intercostals produce inspiration. The internal intercostals help you breathe out. Okay? When the diaphragm contracts, you breathe in. When the diaphragm is relaxed, you breathe out. Other respiratory disorders here include asthma, which is an allergic condition where the bronchioles end up getting smaller, they constrict, and they block airflow to the lungs. Chronic obstructive pulmonary disease, or COPD here, it is one of two conditions, either due to chronic bronchitis, which is the inflammation of the bronchi that produces mucus, the openings become smaller or obstructed, or it could be due to emphysema, which is the loss of elastic tissue on the bronchioles and the alveoli, which collapses now during exhalation. Alveoli lose their shape and their surface area. When you see someone at the mall with an oxygen tank, they probably have emphysema, okay? And they need pure oxygen. The key sign of emphysema is barrel chest. Now, teeth. The cavity here is due to a bacteria that eats away at the enamel. So again, the enamel is the outermost layer of the tooth and is the strongest, but it does wear and tear. The root canal here, if the cavity extends into the pulp cavity, you might need a root canal. So they have to extract all the living tissue out of there. Gingivitis here is inflammation of the gingiva, a lot of times due to a bacterial infection. And periodontitis here is when the gingiva pulls all the way down from the tooth and eventually exposes the periodontal ligament. If that's not taken care of, the periodontal ligament might get eaten away by the bacteria, and therefore the ligament snaps, the tooth is lost. Gastric ulcer is a bacterial infection that can erode the stomach lining. Diverticulitis is a small pouch in the large intestine that can become inflamed. Colitis here is the inflammation of the colon. Colon cancer is #1 most deadly form of cancer that kills more people because it metastasizes, and by the time it metastasizes, it's too late, okay, because you wouldn't even know it. There are no symptoms. And a colonoscopy here is used to look for polyps, which are precancerous growths. Polyps might cause blood in the stool. So as feces is passing through, these polyps are kind of sticking out. The feces ends up getting tough and hard, and if it nicks away at the polyp might open, pop open, or get cut open, and then blood starts rushing out. Another type of GI disorder here are the hemorrhoids, which are varicose veins that are found along the rectum. Hepatitis here is an inflammation of the liver, and these can be deadly. Cirrhosis here is when the liver cells die, often due to alcoholism. And jaundice here is not a disease, it is just a symptom of liver disorder, and it first shows up in the sclera, the white of your eye, because, and it shows up like a yellowish orange color. All right, inside of your stomach, you've got parietal cells and you've got chief cells. And the parietal cells here secrete hydrochloric acid, okay, and digestive enzymes, which help to kill bacteria in the stomach and also for digestion. They also secrete out intrinsic factor, which is needed to absorb vitamin B12, and without it, you get pernicious megaloblastic anemia. Okay, more about that in my blood lecture. Go back and review if you need it. And you also have chief cells, which secrete an enzyme called pepsinogen. When pepsinogen is exposed to hydrochloric acid, if it makes its way into the stomach, it cleaves into two pieces, where one is called pepsin, and this is what digests down protein in the stomach, okay? And pepsin is the active form of pepsinogen. Wow, this is amazing. Congratulations, you've made it through anatomy, you've made it through the lectures of anatomy. All now that you have left to do is take the exams, okay? Congratulations, you've made it through. You've done a fantastic job at putting up with my online lectures or my lectures for like hours on end. You know, way to go. If you have any questions for me, you know how to get a hold of me. If you're enrolled in one of my classes. Otherwise, I wish you all the best of luck in your future pursuits, future endeavors. Best of luck on your exams, and you know, go show the world how much you've learned in this anatomy class. All right. Until the next time we meet. See you later. See you when I see you.